Good evening. This is Nurse Eunice with Florida Drain Academy, and in tonight's video, we're going to be reviewing the basic life support practice examination. So if you are going to be attending an American Heart Association course or even maybe an American Red Cross course, this BLS prep class is going to be for you. And so we'll get started in about 10 seconds. All right, so number one, you work with an overweight 65-year-old resident with no known history of heart disease. He begins to complain of sudden, severe, crushing pain under his breastbone in the center of his chest. The pain has lasted more than 5 minutes. What problem should you think of right away, and what should you do? A, heartburn, tell him to take an antacid. B, angina, phone his personal physician. C, heart attack, phone 911. Or D, arrhythmia, drive him to an emergency department. All right, revealing the answer in 3, 2, and 1. And if this is your first time tuning in, you're welcome to put your answers in the comment area. So Karen and Chrissy, I do see the correct response, and the correct response is C. You want to be thinking about heart attack and you want to phone 911 right away. You do not want to put this person in your personal vehicle because that heart attack, that condition could worsen the cardiac arrest. So great job, team. Number two, you witnessed the collapse of a 45-year-old man. You are now performing CPR after sending someone to phone 911. You have done your best to ensure that the first two links in a chain of survival have been completed immediately. What is the third link in the chain, which will have the greatest effect on increasing this man's chance of survival? And so we'll show the chain of survival, the links in a few moments, but you know that you actually have to activate and you have to start CPR. So what do you think the third link is? Is it going to be A, arrival of paramedics who will administer drugs? B, transportation of the man to the hospital? C, arrival of a rescuer with a defibrillator? Or D, arrival of EMS personnel who can do CPR? Oh, you all are good. I see the correct answers. Yes, it is C, everybody. So, arrival of a rescuer with a defibrillator. And here we have activation, that's the first link, high quality CPR as the second, the use of the defibrillator as the third. And now we need the medical. I can't really see it. I do apologize. We're going to transport the person. And then the fifth link, they're going to need more care. So they're going to be in a post cardiac arrest care unit in the hospital, ICU. And then after that, they usually go to cardiac rehab, where their body's going to be really tired. It's going to take them a while to rebuild their strength. And so they need some rehabilitation. So great job, everybody. Question number 3. You have been talking with a 60-year-old man. He is alert and has been conversing. All at once, he complains of a sudden weakness on one side of his face and in one arm. He is also having trouble speaking. What is the most likely cause of this problem? A seizure, B, heart attack, C, stroke, or D, diabetic coma? I just saw the correct answer. Michelle has it. Gregory has it. So I want you to be thinking about a stroke. And so the stroke assessment that you want to remember, the acronym is FAST, F-A-S-T. Face is the F. Look at their face. It's probably going to be asymmetrical. One part's going to be drooping. A asks them to raise their arms, and one arm will not lift as high as the other. S asks them to speak, and their speech will probably be garbled. And then T, time to call 911, or if you're in the hospital, it's time to call the code. And when you look at this image, the person does have left-sided weakness. And if you ever ask this on a test, when you're ambulating somebody who has had a stroke or weakness on one side, they're the hold a cane with their strong side. So there's just the extra prompt in case you have that on another test. All right, number 4, you remove a 3-year-old from the bottom of the shallow end of a swimming pool. You find that she is limp and unresponsive. No other person is available to help. When should you phone 911? A, after you've given the child 2 minutes of CPR. B, as soon as you remove the child from the pool. C, when you see that after several minutes of CPR, there's no response. Or D, after giving a few ventilations and before beginning chest compressions. This one's tricky. I don't see the correct answer yet. So when you're by yourself and a child is in cardiac arrest, Fortune and Chrissy, you have it right. You're by yourself, you always give 2 minutes of CPR first. Get that blood circulating to the brain before you leave them and go and call 911. Number 5, you are a volunteer helping to set up for a public access defibrillation program at a local shopping mall. The mall has purchased an AED. The mall security director asks, why do the security guards have to learn CPR and be trained to use the AED? Which of the following is the best response? A, rescuers don't need to learn CPR if they can use an AED. B, rescuers need to be able to verify the rhythm analyzed by the AED. C, rescuers need to know when and how to use the AED safely and to perform the steps of CPR for unresponsive victims who are in cardiac arrest. Or D, please ask the mall management the reason why they want security guards to learn to use the AED. What do you think the best response is? Yes, Gregory. Yes, KS Phlebotomy School. Yes, Chrissy, Alicia, you all have it correct. The answer is C. So, yes, head of security, you need to know how to perform CPR and also how to use an AED because you're also responsible for saving the lives of the visitors who actually shop in that mall. Number 6, you're responding to an emergency call for a child who was found unresponsive in her bed with no sign of trauma. How should you open her airway? A, place your fingers in her mouth and pull forward on the lower jaw. B, do the jaw thrust maneuver. C, tilt her head and lift her chin. Or D, pull her tongue forward. And looks like everyone has this right. Mika, Lunide, Godson, Michelle, Tracian. Yes, it is C. You're going to do the head tilt chin lift technique. And make sure that if you're performing mouth to mouth, that you squeeze the nostrils before you provide your breath. Otherwise, the air is going to escape the nostrils and not go into their lungs. Number 7, before providing rescue breathing for an unresponsive victim, you must check for breathing. You do this by nose or mouth and by A, looking into the victim's mouth to see if anything is blocking the airway, B, shaking or tapping the victim's shoulder to stimulate him to breathe, C, checking the pupils, or D, looking to see if the chest rises and falls as the victim breathes. How do you check for breathing in an unresponsive patient? Yes, yes, yes. You all are rock stars. And the correct answer is D. 8, you are in the hospital cafeteria where a woman appears to be in distress. She is grasping her throat with both hands. What should you do to find out if she is choking? A, give her 5 back blows. B, give her 5 abdominal thrusts. C, ask her, are you choking? And be prepared to provide 5 abdominal thrusts. Or D, shake her and shout, are you okay? She's grasping her throat. What question do you ask or what do you do? And so Chrissy is not B, but everybody who chose C, yes, she could be grasping her throat because of other reasons. So you always want to ask, are you choking? And then that's when you can provide those abdominal thrusts, previously referred to as the Heimlich maneuver. And so you're going to place a fist or make a fist with your hand and place that above their belly button. And then you're going to cup that fist and you're going to do upward and inward thrust until the object is expelled. So it may take more than 5, but just keep going until the object is expelled, until the person starts talking and tells you to stop. good job. Or unfortunately, if they become unresponsive, you would have to put them on the ground and start CPR. And number 9, you are providing rescue breathing for an infant using a back mask device. What action will confirm that each of your rescue breaths is adequate? A, determining the infant's weight, calculating the tidal volume. You all, I'm going to stop that. That's just way too much. You're not doing that in the basic course. B, observing the infant's chest rise for each rescue breath. C, choosing the correct size back mask device, which will ensure delivery of adequate breaths. Or D, deliver breaths quickly with high peak inspiratory pressures. Yes, for everybody who chose B, that is how you determine if you're using the bag mask device correctly. So just getting the appropriate size bag and mask does not ensure that they're going to that their chest is going to rise and fall. So you need to make sure, because it could be equipment failure. So you want to make sure you're looking at that chest rise when you're using the bag. Number 10, what is the correct depth of chest compressions in an adult? A, as deep as possible. B, up to 2 inches. C, between 2 and 2.4 inches. Or D, at least 3 inches. Okay, and all of these are based on American Heart Association standards. How deeply do we compress? Elysia, you're close. It's not up to 2 inches. We got to be very specific. Tracian, it's not D. So what's another option? Revealing in 3, 2, and 1. Yes, Fortune. Yes, Pitch Perfect. It's going to be between 2 and 2.4 inches. Or if they ask you in centimeters, it would be 5 centimeters. So adults would be between 2 and 2.4. Child would be 2. And infant would be 1.5, referring to inches, that is. Number 11, how long should a pulse check last? A, as long as it takes to find a pulse. B, no longer than 2 seconds. C, no longer than 5 seconds. Or D, no longer than 10 seconds. How long do you feel for a pulse? Yes, Fortune. Yes, it is D as in dog. No more than 10 seconds. All right, so 10 seconds, you're going to hear that a lot when you're taking the American Heart Association Basic Life Support Exam. 10 seconds is all you get to take your hands off the chest so you want to minimize interruptions in your chest compressions. And 10 seconds is all you get to perform a pulse check. Number 12, where should you check for a pulse in an adult? A, carotid artery. B, brachial artery. C, femoral artery. Or D, radial artery. And we're talking about during an emergency. During an emergency, which pulse do you feel for? Alicia, Gregory, Anna, you all have it correct. The answer is carotid. Yes. So during an emergency, you want to feel for the pulse that's nearest to heart. We do not feel for pulses in the extremities. If that person is unresponsive, we're going for the carotid pulse, which is on the side of the neck, as indicated in this image. 13, where should you check for a pulse in an infant? Now, this is different because of the infant's anatomy. Is it A, carotid artery, B, brachial artery, C, femoral artery, or D, radial artery? Looks like we have it. Poonam, Anna, great job. It is brachial artery. And so it's in the upper aspect of the inner arm. Remember, when you're feeling for a pulse, you feel for it with your index and your middle finger. You never want to feel for a pulse with your thumb, because your thumb has its own pulse. And the reason that we feel for the brachial pulse in an infant and not an actual carotid pulse is, look at the image. The baby doesn't have a neck. They have really large heads and little necks, so it'd be hard to feel for a carotid pulse in an infant. Number 14, a child is gasping for breath, but has a pulse rate of 100 per minute. The rescuer should A, start CPR beginning with compressions, B, give one breath every 6 seconds, C, give one breath every 2 to 3 seconds, or D, do nothing. The child is not in distress. I see a correct answer. I think Karen's the first one. So, everybody, for adults is one breath every 6 seconds. But for a child or an infant, if they're having respiratory problems, you want to give a rescue breath every 2 to 3 seconds. Remember that if a child is, if we're trying to prevent cardiac arrest in a child, more than likely anything that's wrong with them was caused by their respiratory system, their lungs. So we need to supplement and give them some oxygen if she's gasping. Otherwise, the heart muscle is going to die, and then we'll have to start chest compressions too. So one breath every 2 to 3 seconds was the right answer. Number 15, a child is not breathing. This one's different, but has a pulse of 50. What should you do? A, start CPR beginning with chest compressions. B, give one breath every 6 seconds. C, give one breath every 2 to 3 seconds. Or D, do nothing. The child is not in distress. Gregory, you have it. Yes, it is A. So let me tell you all the difference. Because an infant's or a child's heart beats much faster than an adult, when their heart rate gets down to 50, we're not going to let this baby's heart get to 0 before we begin starting CPR. So for an infant or a child, if their heart rate is less than 60 with signs of poor perfusion, the child wasn't breathing, so we know they have poor perfusion, we have to start CPR. But let me go back to that image. And remember, when you're performing CPR on a child, you can use 1 or 2 hands. And as I stated before, you're going to compress 2 inches. Number 16, a 70-year-old man who has been eating steak in a restaurant abruptly stands up and grabs his neck. The rescuer determines that the victim is choking. The best response is to A, use back blows, B, do nothing, C, use abdominal thrust, or D, use upward chest thrust. Yes, Alicia, Gregory, Anna, Peace. You are absolutely correct. Y'all don't hit them in the back. Don't do back blows. If you do back blows, you make the object go down in their lungs. You don't make it come up. So you want to do those abdominal thrusts, previously referred to as the Heimlich maneuver. Number 17, an infant who has been choking becomes unresponsive. What do you do? Alternate back slaps and chest thrust. B, perform a blind finger sweep. C, attempt to dislodge the obstruction. Or D, begin CPR. The choking infant is now, they're no longer moving. What do you do? Alicia has it. Whenever anyone who is choking stops moving, you are to assume they have died, they're in cardiac arrest, and you are going to begin CPR. So the correct answer, yes, it is D as in dog. Number 18, efforts to relieve choking should be stopped when the obstruction is removed, the victim becomes unresponsive, the victim begins breathing normally, or if any of the above occurs. When do you stop trying to help a choking person? I'm revealing the answer in 3, 2, and I tricked you all. It is D. You don't want to keep doing the abdominal thrust if the obstruction is removed. If it's A, You don't want to keep if they become unresponsive because you have to start CPR. And if they start breathing normally, that means you did a perfect job. So the correct response for this one is D as in dog. And if any of you are interested in becoming CPR, BLS, ACLS, or PALS instructors, I am an American Heart Association Senior Training Center faculty member for all of those disciplines. So not only do I train students, but I also train the instructors that train students. So my website for CPR equipment is nurseunits.com. And if you stay to the end of the presentation, you'll see our business's website where you can actually register for your instructor courses. Number 19, in which of the following situations is moving a patient during CPR appropriate? A, the patient is laying on his stomach. B, the patient is in a burning building. C, the patient is on a soft mattress. D, the patient is in a place or position where you cannot do CPR effectively. Or E, all of the above. When should you move someone? Yes, Alicia. Yes, everybody. It is E. So imagine you walk upon a person and they're face down. You have to move them before you start CPR. And if they're on a bed and you try to start your compressions, the bed is too soft. So you may have to move them to the floor. So there are going to be times where you have to move someone before you can begin those chest compressions. Number 20, in two rescuer CPR, where the patient is between 1 year old and puberty, the chest compression to breath ratio is, so two rescuer child CPR. The compression to breath ratio is at 15:1, 15:2, 30:1, or 30:2. Yes, everybody. If it's two rescuers, it is going to be B, 15:2. And what we find is if you have help, two or more rescuers, and you switch to 15 compressions followed by 2 breaths, you end up giving nearly 30 breaths within the same 2-minute period. And remember, if a child or an infant goes into cardiac arrest, more than likely it was due to the lack of oxygen. So they need those extra breaths. And so as a reminder, your compression rate for all ages is 100 up to 120 compressions per minute. If it's one rescuer for all ages, it's going to be 30 compressions followed by 2 breaths. But if you have help and it's a child or an infant, you want to switch to 15:2 if you have another rescuer assisting you. Number 21, over what age should you use an adult AED or adult AED pads? 8 years of age, 12 years of age, 18 years of age, or 21 years of age? When do we switch to the adult pads? Everyone's getting this right. It is A, yes. And so always follow your manufacturer's guidelines. But according to American Heart Association, once a child is 8, you want to use the adult AED on them. And I don't know what an 8-year-old looks like, so I just chose this photo. Don't judge me. All right, number 22. What is the recommended length of time for a pulse check? And you all should know this one. I already gave you the answer. You can't take your hands off the chest for no longer than how many seconds? And how many seconds do you limit your pulse checks to? Revealing the answer in 3, 2, and yes, it is B, 10 seconds, you all. That's all you get to feel for a pulse, 10 seconds. If after 10 seconds you don't see any movement, you don't see chest rise and fall, you don't feel a pulse, I need you to assume that person's in cardiac arrest and start your CPR. We'd rather you start it and they not need it versus you be so nervous that you don't know if you're going to do something correct, that this person's dead, they don't have any brain blood flow going to their brain, and you just stand there and do nothing. So when in doubt, start the chest compressions. If you're in a home care setting, you have 911 on the phone. If you're in the hospital, those nurses in that rapid response team will be there soon. Number 23, what is the approximate rate of compressions in adult CPR? Is it 60 per minute, 80 per minute, 100 up to 120 per minute, or 60 to 100 per minute? This one's kind of tricky. I tricked you, Alicia. So 60 to 100 is if the person's heart was beating on its own. So that's the normal adult heart rate or pulse rate. But when you're performing compressions, if you chose C, you are correct. You want to compress at a rate of 100 up to 120 compressions per minute because you have to be better. You have to be on top of this person's chest. You're not as effective as their heart. So we need you compressing a little bit faster. Okay. Number 24, which of the following is not a component of high quality CPR? A, at least 100 chest compressions per minute. B, minimal interruptions in CPR. C, allowing complete chest recoil. Or then D, all are components of high quality CPR. Which is not a component? All right, so I see I have to explain what chest recoil is. You all, the correct answer is D. All of those are components of high quality CPR. So we're going to start our compressions within 10 seconds. So all we get is 10 seconds to check for the pulse and to check for breathing. You're going to push hard and fast, 2 inches for an adult up to 2.4 inches. You're going to minimize chest compressions, minimize interruptions in chest compressions to no longer than 10 seconds. And what we mean by allowing chest recoil is that whenever you compress down on the chest, you circulate the blood throughout the body. But when you let the chest rise, recoil, you allow the heart time to refill with blood. So you don't ever want to keep constant pressure on the chest because that means that you're always squeezing blood out the heart. You're not giving it time to refill. Number 25, this is an easy one. What does AED stand for? Automatic energy delivery, automated external device, automated external defibrillator, or D, autonomous energy defibrillator. What does the AED stand for? Yes, Anna, Alicia, Gregory, everyone got this right. The AED is the automated external defibrillator. And yes, they're really easy to use. If you don't open them, if it doesn't automatically start talking to you when you open it up, you just press the start button. It is voice guided. You listen to the prompts. And then, yes, you can use an AED on a pregnant mother. Yes, you can use an AED if someone has an implanted device, such as a defibrillator. You just can't put the AED, the external pads, on top of whatever implant device they have in their body. But hopefully your instructor during your CPR, your BLS class will cover that in more detail, and you will have an opportunity to practice with their AED training device. And you all know how much I appreciate you, and you're going to make such great caregivers. So this is Nurse Eunice, and I will see you all in the next video. Thank you for watching, everybody. Bye.